Dear students, welcome back. In the previous session, I have given some introduction about the handling activities, that is prehension and its types. Normally, the prehension is of two types. One is power grip and another one is precision handling. Out of power grip, it is again further classified into cylindrical grip, spherical grip, hook grip, and also another grip is also included in this power grip, that is lateral prehension. That lateral prehension is commonly occurs when a contact occurs between two adjacent fingers. So this one is a unique form of grasp. Okay, they included this lateral prehension after some time. Okay, so now in this session we are going to discuss about cylindrical grip. The cylindrical grip is a type of power grip. Okay, now we will see what will happen in the case of cylindrical grip. So what do you mean by power grip? The fingers in power grip usually function in concert to clamp onto and hold an object into the palm. Okay, here the fingers assume a position of sustained flexion. Here the fingers are in sustained flexion that varies in degree with size, shape and weight of the object, and the palm contours to the object as the palmar arches form around it. Okay, here the thumb may serve as an additional surface to the finger palm wise by adducting. So here the thumb is acting by adducting against the object, or it may be removed from the object. So this is the thing happening in the power grip, and also we already know the sequence of the power grip, how it takes place, isn't it? It has four steps in the power grip. One is opening of the hand, positioning the fingers, approaching the fingers to the object, and maintaining a static phase, which actually constitutes the grip. These are the four steps. So those sequence is also seen in all the different types of power grip, whether it may be cylindrical or spherical hook grip. So all these steps we can see in this. You have to mention this sequence of gripping is very important. Okay, now we will see the cylindrical grip, especially the cylindrical grip. The cylindrical grip almost exclusively uses flexors to carry the fingers around and maintain grasp on an object. So in this grip, the flexors are mainly used. The two finger flexors are mainly used to grasp the object. Okay. Next, the function in the fingers is performed largely by flexor digitorum profundus, especially in the dynamic closing action. So if you see the closing action, so if you can see the distal interphalangeal joints, so which are going to press or which are going to surround the object or touching the object with some pressure. So that one is carried out by this flexor digitorum profundus. Okay, in the static phase, flexor digitorum superficialis assess when the intensity of the grip requires greater force. So if the grip is the intensity of the grip is more, then it requires greater force. So along with FDP, FDS is also assisting in the grip. Okay, so as we know that the power grip is normally traditionally can be brought about by extrinsic activity. These two muscles are extrinsic muscles, but also some of the studies have indicated that some considerable interosseous muscle activity is also seen. So these interossei are considered to be functioning at the MCP joints. At the MCP joints as flexors as well as abductors or adductors. In strong grip, the magnitude of the force of interossei in metacarpal flexion has been found nearly equal to the extrinsic flexors. In strong grip, both the interossei as well as the extrinsic flexors will have an equal magnitude of force. Okay, here because the interphalangeal joints are being flexed, the MCP flexion task most likely falls to the proximal interossei. Okay, so the so-called rotation task of the interossei is to position the MCP joint in the proper abduction or adduction for application of the pad of the finger to the object. Yes, next the combination of MCP flexion. So the combination of MCP flexion as well as a deviation gives the appearance of the rotation of the phalanx. Although location of lumbricals indicates a possible contribution to MCP flexion, but in EMG activity, the lumbricals doesn't show any stimulus for this kind of activity, but it has a major role in interphalangeal extension. Okay, so now we will see what actually, so these are all the muscles which helps in cylindrical grip. Now if you see the positioning of MCP, IP and also wrist, what is happening during this cylindrical grip? Okay, so there is frequently a symmetric ulnar deviation. You can see the ulnar deviation of the second to fifth MCP joints, which results from the increased range of flexion available to the more ulnar finger joints. The first one is, you can find this ulnar deviation, and this ulnar deviation is increasing from second to fifth MCP joints. So how can you say that this is increasing? Means, as we know that we have discussed in the previous sessions regarding MCP joints, the increased range of flexion is increasing from radial to ulnar side, isn't it? So that is the thing happening here also. So because of increasing, so I have told that if the ulnar side fingers is having more flexion, it mainly helps in gripping action. Now here you are seeing such kind of thing here. Okay, this deviation points the fingers towards the thumb. So already, so you have seen that this is the ulnar deviation of all the fingers. You can see in this pic, so all the deviation and flexion of these fingers, so or directing towards the thumb. Okay, and then it also produces lateral subluxation force on the MCP joints. So what happens if it is deviating? So there may be some subluxation of joints towards the lateral side on each joint, and this one is prevented by the subluxing forces, or prevented by, actually this subluxation is caused on the MCP joints and also on the tendons of the long flexors of the MCP. Okay, so the subluxing forces are controlled by radial collateral ligaments of MCP joints and also by the annular pulleys which anchors the long tendons in place. So these are the things happening here. Okay, and also these structures are assisted. So normally what are the structures? These radial collateral ligaments and annular pulleys are normally assisted, especially in isometric functions, by the active or passive tension in the extensor digitorum tendon. Okay, so here the extensor digitorum is also having some function. What is that function means? It increases the joint compression. So all this are flexing all the fingers, but on the antagonistic side, so this extensor digitorum increases the joint compression. So on the antagonistic side also it is having some contraction which increases joint compression and enhances joint stability. Okay, so normally in the grasping functions, the extensor digitorum activity is used to increase the stability needs. Okay, so these are all about the fingers. Now if you can see the fingers, if you can see the thumb here, the thumb position in cylindrical grip is the most variable of all the digits. Okay, the thumb usually comes around the object. You can see the thumb usually comes around the object. So this one is a mobile phone, so it comes according to the shape of that object. Okay, then flexes, so it comes around it and the thumb is flexing, and for gripping, so the thumb has to adduct. So flexing and adduction is taking place. Okay, so what is the action of the thumb here? The thumb usually come around the object, then it is flexing and adducts to close the object. Okay, normally in this, the muscles which helps in this are the flexor pollicis longus and the thenar muscles are all active in the case of cylindrical grip. Okay, and here also the extensor pollicis longus is also active as an MCP stabilizer of the thumb and also as an adductor. And also hypothenar muscles, hypothenar eminence, that means at the digiti minimi. Okay, so which are usually very active in cylindrical grip. Okay, so and finally we can say that the cylindrical grip may be accompanied by the ulnar deviation of the wrist, since this is the position that optimizes force of long finger flexors. The least flexion force is generated at these joints in wrist flexion. The heavier an object is, the more likely it is that the wrist will ulnarly deviate. So if the object is heavier, and the ulnar deviation is also more. And also additionally, a strong contraction of the flexor carpi ulnaris at the wrist will increase tension on the flexor retinaculum. This provides, so all the thenar and hypothenar muscles, isn't it? All these muscles are originating from the flexor retinaculum as well as the carpal bones. So once a strong contraction of the flexor carpi ulnaris at the wrist will increase in the flexor retinaculum, and this flexor retinaculum provides a more stable base for the active hypothenar muscles which originate from that flexor retinaculum. Okay, and because of this stable base, the muscles will work very effectively. Okay, yes. And also some of the studies have mentioned that the total interphalangeal flexor force is mainly 70% seen in the index and middle fingers. The ring and little finger serves as weaker but more mobile. So the little and ring fingers are more mobile and assist to more stable and stronger index and middle fingers. So these are the things happening in the cylindrical grip. Okay, in the remaining grips also we can see the same combination of these muscles, but some changes in the joint position is taking place. Okay, so this is all about the cylindrical grip. In the next session we are going to discuss about the spherical grip. Thank you.